Welcome to McGuireWoods Healthcare Headlines. I'm Amber Walsh, Chair of the McGuireWoods Healthcare Department, and I'm very pleased to be here with you for the relaunch of our video series. Our original video series was launched in the middle of 2020, in the midst of the ever-changing regulatory landscape. We launched it swiftly and in order to very quickly be able to disseminate information to healthcare providers, investors, and other stakeholders in the healthcare industry on a very rapid basis. We are now relaunching the series. We have a new look, we have new topics, and we're going to have several guests who are sharing their expertise on various healthcare headlines. I'm very pleased today to be joined by Andrea Linna as our first guest in the newly launched series. I think it's very appropriate that Andrea is our first guest. Among other healthcare expertise, she is a digital health expert, and she has recently joined McGuireWoods along with two other very experienced digital health partners and our existing strong digital health team to really grow out that McGuireWoods expertise. As a firm that seeks to always be on the forefront of innovation, we're excited to be building out this digital health platform. And I'm very glad that Andrea is joining us for our relaunch of the series. Welcome, Andrea.
Thank you. Excited to be here.
So, Andrea, I know that you have a lot of expertise in healthcare M&A and other regulatory areas, but can you just describe your digital health practice in particular, please?
Yeah, sure. So I focus my practice on digital health, helping healthcare companies navigate telehealth, remote patient monitoring, different emerging technologies, wearables, and then HIPAA and healthcare IT that really play into that.
So let's talk about that in a little more specific. So since the beginning of the COVID-19 pandemic, telehealth demand has soared. We have all seen that in our professional lives, in our personal lives, and regulatory burdens were lifted. We reported on a lot of that back in 2020. Can you talk about the impact of federal and state regulation on now the future of telehealth?
Yeah, absolutely. Well, this is a huge piece of where are we going next? What's going to happen post-pandemic? I mean, really during the pandemic, there was the huge spike in demand, but there was also at the exact same time, all of these regulations that kept telehealth down were all lifted literally overnight. So you had this perfect storm of the ability to really accelerate telehealth very quickly. But in order to maintain that momentum post-pandemic, we really have to have that same momentum and a lot of those same rules lifted. Even if we don't get every single one, we need a lot of that in order to sustain the investment and interest in telehealth so we don't lose that momentum that we've received. And just a couple of examples. So Medicare, for example, at the beginning of the pandemic, or pre-pandemic, used to require that you had to be at a certain originating site in order to be reimbursed for telemedicine. So the patient had to be in a facility setting. They couldn't be in his or her home. And they also had to be outside of a metropolitan statistical area, and then also in a healthcare professional shortage area, and which is really small part of the United States where you could actually be reimbursed for Medicare telehealth services. So when the pandemic happened, all of that was lifted. So patients were able, really anywhere in the United States, including their home, could receive Medicare telehealth services. So that was one huge one because that's always really held back telehealth, especially in Medicare, because elderly patients, they want to be in their homes. They don't want to have to leave. It's a perfect solution for them, but then providers couldn't be reimbursed. And obviously, if there's not ability to be paid for their services, it doesn't make sense to invest in those areas. So that's an example of really the regulations that were holding telehealth back that were lifted during the pandemic. And we need to figure out a way, and we're very hopeful and very optimistic that those regulations are going to continue to be lifted into the future. And that's what we're going to talk about today, is some of those bills and some of the things that we're seeing coming and what we hope is going to happen post-pandemic.
So pretty important that federal restrictions are lifted. So do you see any progress So what do you really think is going to happen on a federal basis?
Yeah, well, so there's lots of pressure, right, from industry experts and people that have started to invest in this space, as well as from patients where they are getting used to, hey, picking up my phone and able to contact my provider. So we are seeing some momentum, bipartisan momentum. There's a couple of really interesting bills that have been introduced that I can walk us through. One of them is the Protecting Access to Post-COVID Telehealth Act, which is really probably the most exciting one. It's getting the most press, probably has the best chance of actually becoming law. But what it does is it says all of those geographic restrictions that I was talking about, where the patient couldn't be in his or her home, or they had to be in specific zip codes in order to receive services. It takes all of that away. And it says exactly what's happening now in the pandemic. It's here to stay, which would be fantastic. And so we're really hoping that that is the one that, gets some real momentum here. And the bill also requires that they assemble a group of experts to really report on how telehealth was used during the pandemic. And so that, I think, as well, and that's a theme through some of these other bills, is this concept of, well, we need to start researching now. What happened? We know that it was accelerated and that we had a lot of visits, but did they work? Was there any people taking advantage of that, et cetera? We need to really study that and understand the data. So a lot of these bills really try and get to that and get to the bottom of these items to help inform future regulation. So that's really exciting one. Another one is Equal Access to Care Act. And I think this one, I would personally think it's unlikely that it would pass, but we'll see. I've been wrong. It's called the Equal Access to Care Act, and it basically allows, if you are licensed, for example, if you're a provider and you're licensed in New York and your patient goes to Florida every winter, you could not see your patient over telehealth because you aren't licensed in Florida. So the licensure follows the patient, if that makes sense. So this bill is actually switching that and saying, well, as long as you're licensed in the state where you are as the provider, then you're good to go. You can continue to see that patient. I'm not sure how that works with state law, and I'm curious of how they would work that out because state law would trump. But that's one where I think it brings to my mind a real discussion point around licensure. And because that has always existed, where you have to be licensed in the state where the patient is located, it makes it incredibly difficult to be licensed in 50 states. And even pre-pandemic, there was the Licensure Compact Act, which made it easier to become licensed in other states, but it still wasn't easy. So now there's this discussion of, well, can you be licensed in all states? Could we start talking about something like that? And I think as lawyers, we're the same thing. Any licensed professional, it's really difficult to be licensed in other states. So that's starting to get that conversation going. And I thought that was really interesting to see some support of that on the federal level. Another one, Ensuring Telehealth Expansion Act, basically does the same thing of lifting all of the restrictions, but only until 2025. Which helpful, not perfect. I would still want it to be forever, but I'd take it if I could get it. So those are some examples of trends that I'm starting to see. And then there's a Medicare Payment Advisory Committee that advises Medicare on what it should pay and how it should pay. And they met at the end of last year, and they have this really interesting PowerPoint that I'm happy to provide, but it goes through some of their thinking on the future of telehealth. And they talk about bringing back the restrictions that apply to HIPAA, for example, making sure HIPAA is completely reestablished. And so you couldn't provide telehealth over Zoom or Skype or whatnot. They talked about prohibiting billing for DME and lab tests over telehealth, which is currently allowed. Talked about paying lower rates for telehealth visits versus in-person visits. And right now they're paid the same. So I think, again, that gives you an idea of, well, they're going to be advising Congress. Here's some things that they're thinking about and some trends in that area. So all of those really get you thinking about kind of what the landscape is going to look like. But just the fact that we have all of these bills and we have all this discussion makes me very optimistic that there's going to be some movement. It's just how much and when.
Really fascinating issues raised in a lot of those bills, and we all saw throughout the pandemic, and certainly we are still in the pandemic, but hopefully nearing the end. We all saw many points of progress being accelerated by the pandemic, and this is certainly one of those areas. The issue of the universal licensure is a really fascinating one, and really drives towards, who should be regulating. Is it state level? Is it federal level? The extent to which states that have very different regulatory philosophies can have the right to regulate their citizenry, even if it impacts other citizenry outside their state lines. Very interesting issues. And I know that there are some state level legislative movements going on as well, correct? And you can share a little bit about some of the more interesting ones. Certainly you can't go through here a 50 state survey, but some of the more interesting developments
going on for hours. Yes. So I'll highlight on just some of those that I think are really interesting right now. One is California, obviously very progressive state. It's looking at its Medicaid programs and how telehealth is going to work for the Medicaid population. They came out with a report, and something that stuck out to me, as I hadn't really thought of it before, was they talked about how significantly telehealth reduces no-show rates for patients, and what that was really helpful to their Medicaid providers. And it was much more efficient because patients could really see their provider as necessary in their schedules. And I have felt the exact same way as a professional of having to leave, drive somewhere, It's too much work. It's much easier to be able to just see your provider right on your telephone. So I think that's another interesting data point around another way that telehealth can be really great and save a lot of time and save a lot of money. Washington is another state which has taken a different approach of it narrow to nursing homes. So just applying these expansion of telehealth rules for individuals in nursing homes because they have been hurt and hit so bad. So looking at how telehealth can improve those populations. New York is another one. They're hoping to permanently eliminate the originating site geographic restrictions like we talked about in Medicare and wipe out any requirement for in-person visits. They also, which is another good one, is they want to cover audio-only telehealth services. And this one is interesting because even if you have a smartphone, and let's assume that every patient does, which is absolutely not true, you have to turn your video on in order to be reimbursed for teleservices because it has to be audio and video. So at any meeting that I've been in, it's hard enough to get people to turn their video on, let alone if you're with an elderly individual that may not know, many features of his or her smartphone. So thinking about, audio only coverage, I know that's happening right now in the pandemic that you can get audio only coverage, but is it going to happen post-pandemic? And if it does, what are the rates for what services? So I think that's a really interesting one to think about, both the technology and the payment and how that's going to work. And then New York is also focused on adoption. They want to have public campaigns where they really encourage their citizens to use telehealth. They want to implement training programs for providers. So really thinking about the education and getting people aware of the fact that they can use telehealth, big push in New York for that. And then my last and final best state, I think, is Idaho. So they have this Red Tape Reduction Act, and they have the least regulation in the entire United States. And so they came out during the pandemic, they wiped out all of the telehealth regulations. And then by June, they had another executive order which said they're never coming back. And so that's already said and done. There's no more restrictions on telehealth like there was pre-pandemic. And they actually allow any provider licensed in any state to provide telehealth services to their citizens. So really cool examples of what's happening on the state level. And I think that too will encourage change on the federal level because there's going to be that pressure. There's going to be all this great data on how helpful it has been.
And everything that you described there has given me all sorts of new ideas of all of the regulatory change obviously has ripple effects. And you think about anything that is a dramatic expander of access to care, which certainly development in telehealth falls within that category. You then have to educate patients. So you mentioned the one state that was doing the adoption programs, but you can envision, and I'm already thinking about how our firm can help in helping to establish and support local programs to get patients who otherwise might not understand that this is an available service, how we might be able to help in that. So I think about years ago with advanced directives, and when something is available to patient population or translation services, these things that become available, much needed services, you then have to make sure the patients understand it and can actually receive it if it's going to actually have an impact on clinical quality.
Yeah, no, those are great ideas.
Well, thank you so much for sharing all of this. Obviously, there's a lot of things in the works that you are watching. We barely even hit the tip of the iceberg on reimbursement. There's so many different topics within the realm of telehealth. We will certainly be having you back on McGuireWoods Healthcare Headlines. I know that you and our other digital health colleagues are publishing, you're doing your own thought leadership and platforms to make sure that the information gets out there. But I really appreciate you being our very first guest on the relaunch of our healthcare headlines. And now it's just back to work. Thank you.
Thank you.